Dr. Sean Altman, welcome to the podcast.
Thank you. Thank you.
You have quite a specialty, quite an expertise. I'll let you explain to everybody what exactly you do.
Absolutely. So it's taken me quite a while to come up with a name for what I do, but I think the best way to describe it is orthopedic functional medicine. So I work within the longevity medicine space, and I help people with various types of pain, orthopedic injuries, nerve pain, neuropathy, all different types of pain. And, we get to the root of what's causing their pain, both from a structural standpoint, but then also from a systemic standpoint, by looking at the body as a whole, by looking at the body holistically. We forget that pain and muscle tension and inflammation are local processes, like at the level of the injury, but they're also global processes where they affect the whole body. And, when we start to treat the body in that global, holistic sense, people get better a lot faster and they feel better a lot faster. And that has really anchored, the type of medicine I've begun to practice over the past 7 to 10 years. And it's something that gets reaffirmed every single day. When I see patients, kind of breaking through and feeling better about themselves, about their injury, and just getting that vitality back, that zest for life.
Getting the vitality after an injury, that's a good place to start. A lot of people get some sort of injury at some point, or they might have a phase where they can't get as much movement. And then how much of this is about mindset, having the courage to get back out there, get back into what we should be doing?
I think it's a combination, but I think um I was talking to someone about this earlier today. I think that traditional medicine often puts the cart before the horse. So in order to move, and to feel safe to move, the body and the nervous system have to feel safe. So what I find is if we're able to spend, 2, maybe 3 treatments calming down the inflammation in their body, re-regulating the nervous system, getting their body and their nervous system in a place where it's more comfortable, then exercise, movement, all of that becomes much easier. And then the recovery ultimately moves much faster. um, you know, we shouldn't really be stuck in this mindset of like pushing through the pain, no gain. Like we learn, in athletics, because it really doesn't serve us well in the long run. It's important to look at these symptoms: pain, inflammation, muscle weakness, nerve symptoms. They're signals that your body is telling you that something's wrong. And if you're able to right that wrong or start getting the body into a place where it feels better, then you can get back on track much quicker. So it's just this intuitive nature that we realize that just you should listen to your body and find what it needs first.
Absolutely. There's a lot of talk about the nervous system now from all sorts of professions, the mindfulness space and the medical space, and probably a few other specialties as well. I'm wondering, how do we know, firstly, what our nervous system is and what that means in a practical reality, but also how do we know if something is off? Is it when perhaps someone has been in shock, or if someone is not feeling confident? What are we talking about when we're talking about the nervous system?
So the way I investigate someone's nervous system is more we would call like data driven. So looking at actual metrics, things like heart rate variability, and sleep quality. There are ways to measure how well the nervous system is performing. And you can look at that in terms of like a snapshot, so like a period of time where you're tracking the person. Or in a lot of cases, many patients I see these days have wearables, things like Apple Watches, Fitbits, etc., where there's historical data. And you can look back at historical data and see if there has been a change in terms of, various metrics. And that becomes a very definitive, evidence that there has been a change in the nervous system. And yes, very often it's precipitated by either trauma, big T trauma, or little t trauma. Um, Big T trauma meaning like a major accident, like a car accident or an injury or a fall. That's a major traumatic event. But then there can be little t trauma, like having a very stressful job or having challenging time, say parenting or, some sort of life struggle. And that can cumulatively add up to a heightened state of sympathetic nervous system activity where we are stuck in this fight or flight mode where our, you know, heart rate, blood pressure, cortisol levels, various hormones are consistently elevated. And again, like I said, there's metrics behind this. There's ways to test it through the wearables, looking at data that way, and then we can even verify often just in someone's blood work if things like cortisol are elevated or salivary cortisol testing too. So, I try to use the data when possible for two reasons. Number one, diagnostically, it holds up better. Someone's more likely to believe you if you have data attached to it. But we can also use it to show progress. We can use it to re-record and re-measure and see that someone is doing better and responding well to interventions. And that's an objective way to track that. But I do think that the concept of the nervous system has been a bit oversimplified in terms of the way that we talk about it on social media, or even the way it's being talked about in terms of things like mindfulness, et cetera. The reality is that our nervous system should be able to be variable. And that's what heart rate variability measures is the variability between the heartbeats. A healthy nervous system has a high variability. So that means that a healthy nervous system can go high, like it can get escalated, elevated during times of stress. So stress could be physical or emotional stress. Stress could be, working out at the gym, doing weight training or running a marathon or whatever. And then when we need to calm down, a healthy nervous system can de-escalate. It can calm down. It can rest and digest. It can promote healthy, restorative sleep. And then we can recharge and do it again the next day. Um, it gets oversimplified where people think that just teaching their nervous system like to meditate and calm down during one interval is going to make it more adaptable to daily life stresses. And it doesn't always translate that way. I often tell patients, can you meditate when you're on the verge of like a panic attack? Probably not. You know, so my goal with patients is to teach the nervous system to be more balanced, but also to teach it to be more resilient, more able to handle stress and then calm back down without having that difficulty of de-escalating.
Are you saying that the nervous system is doing better, not being in a straight line, but when it's able to level out after it is required to be heightened?
Yes, exactly. And that's really how I gauge like a healthy nervous system is, I will look at wearable data in terms of when someone exercises, how quickly is their heart rate and their vitals able to drop back down to normal. And then something that's useful in terms of training that is things like interval training, high intensity interval training, where you're teaching your body to like sprint and then go back down to a coast sprint and having that flexibility preps your nervous system for those times of stress and also decreases the likelihood that your nervous system will overreact to that type of situation because you're training. It's a form of training, you know, and that's what exercise and a lot of things we do are geared toward is teaching the body to be able to handle, things that it encounters.
I have a couple of questions about all that. Firstly, I'm wondering if different people are more sensitive to the nervous system issues than others. And also, I'm wondering where fear plays a part in this. It's great to hear that we can measure things like our sleep, but the underlying emotions, I'm wondering where fear fits into all of this.
Absolutely. No, there's people of all types. They can have, backgrounds that involve abuse and emotional issues. And that certainly is extremely relevant, and obviously psychotherapy and, treatment and addressing that is part of the process. Um, but I think that very often nervous system regulation, in addition to being a mental and emotional, state, is also, we would call it like an energetic state. So it has to do with how the energy flows through our nervous system, and emotions are going to affect that. But then there is a way to address it from the other end, like from the energetic, molecular, chemical, more scientific way. And I'm not saying one or the other. I'm actually saying both. I think it's the combination of the two. Um, but it's important to I think of it like tools in a toolbox. There are, tools that are going to work on emotions that, may involve things like talk therapy, CBT, DBT. I know all about that from my wife, who's a therapist, and working with therapists, and working in trauma, quite so many years. But then there's somatic, so that's body problems. Then there's chemical problems and, system level problems. And those are going to be addressed more with a physical intervention instead of a verbal or, emotional one. So I think it's often the blend of the two. Um, but you're absolutely right. Like fear is definitely so, there's a part of that that's, stems from all of this. And just like, orthopedics, where we're looking for the root of someone's, say, pain, there's probably a root to someone's fear, that they're dealing with, and getting at that is helpful. Um, but doing it from that physical and chemical standpoint also helps, because whenever we experience any type of emotion, there are hormones and chemical signals and electrical signals and, things going on within our body that accompany that feeling and that emotion. So, you can treat that simultaneously, or just in conjunction with, whatever therapies you're doing.
It's encouraging to know there are physical solutions beyond simply talking about things, because when we're dealing with the physical body, although the mind is connected, it's clear that there can be something else going on, or the memory. People say that the memory can be stored in the body in some way.
And there are many examples of like emotional states being caused like purely by physical issues. I've had patients who have been dealing with anxiety and depression because of simple vitamin or mineral imbalances that come up on blood work, and that entire emotional state is resolved once that's corrected. Um, I have this very interesting case of a patient who got this very fancy infrared sauna that also had phototherapy. So very like different types of light to stimulate brain waves and mood, for there's like, different light waves for, making you more calm or more, attentive, focused, etc. And he really enjoyed the blue light, which is only supposed to be used sparingly. And he was actually like doing too much of it and gave himself depression from the blue light. And as soon as he stopped doing the blue light therapy, it resolved. Um, so it shows us there is that interplay between the physical and the emotional. And having that differential diagnosis, that functional medicine approach to it, helps us to tease out all of these factors and really establish what the nature of their issues are.
It sounds like sometimes people are using too much of a good thing. I'm wondering if you have more examples of that. The one that I have, I don't know where I will draw the line, but a few times in the past year, I went to 4 yoga classes in a row, all in one go, 4 classes.
Hmm.
That's on the extreme end. Everybody would have something that they are doing to the extreme, perhaps getting a bit obsessed with the ideal diet. Even though we need to eat healthy, how far do we take that? Or people go to the gym a lot. How do we know where to draw the line? Do we need to get someone else to help us to measure whether we are taking our habits too far or not?
I think it goes back to that theme of listening to your body, where I imagine, when you do too many yoga classes in a row, all of a sudden, the poses and the stretches start to feel a little more uncomfortable, because you probably cross this line where now you're overstretching areas instead of just promoting flexibility, and mobility. Now you're starting to create more micro tears and the body's not responding well to it. And the same thing goes with other, lifestyle activities. Um, so yeah, I mean, I think I- you know, it depends on the person. I think having someone like a health coach is excellent because they can coach you and move you along and make sure that you're not overdoing these things. Um, I recognize that that's not always within everyone's budget. So, I'm a big fan of them if that's possible, if you can have someone that's, keeping you motivated and just watching you along the way. But if you're not, then I think that's when, you have to become more aware of yourself and listening to your body and figuring out that balance. And what is the right amount for you to feel good and not pushing it too far. Um, and you're absolutely right. I mean, people get hooked and they start doing too much, yoga or spin classes or running. I see a lot of runners that have, overuse injuries, stress fractures, Achilles, etc. Because running is also addictive. We have that endorphin rush when we run. So it's definitely part of this larger process of listening to those signals that your body gives you that, oh, this, like, now I'm starting to get a little bit of pain. Maybe I need to take a day off. Maybe I need, and I think that goes to this larger message that we need that balance for our nervous system. We need the rest. Our body needs rest days occasionally, at least once or twice a week, to repair, to build new muscle, to respond to these positive interventions. If we're not doing the appropriate amount of rest, it turns into, things like overtraining and injuries and all of that. And, you only need to look at, professional athletes to see a lot of those examples of what can happen when you push the body too far. So if you're not being paid to go to do yoga or, exercise or any of these things, I think you have the autonomy to decide, okay, let's today be a rest day. Let's relax and let my body reset and recharge. And, you'll realize you're all the better for it. Um, I've had patients on training programs and they're always fascinated by the fact that, like, structuring it a little differently, adding a rest day, having them actually like work out less makes them feel better. And sometimes they'll actually put more muscle on that way. And they're always confused because they're like, I don't understand. I feel like I'm doing less, but I'm getting more out of it. And I'm like, it's just more like the body needs rest and it needs a certain amount of stress to get better. But too much stress is harmful. It's if we, and I'll stop after this, but like a classic example of hormetic stress is something like a sauna or cold plunge. There's a specific temperature range that is therapeutic, but if the temperature range of the sauna is too high, we could burn ourselves. And if the temperature of the cold plunge is too low, we could get frostbite and freeze. So there's a just right amount for everything.
There really is. The cold plunges, the ice baths, there are all these names for it. I feel so cautious about those. I dipped a limb into one of those and it was very much electronically managed. It wasn't just someone putting a bunch of ice cubes in water, right? And I just felt numb instantly. I thought, I don't know what this is meant to. It felt like something was happening to me. So I totally agree that we need to be careful and listen to ourselves. Beyond listening within, I'm so keen to ask about AI. I wonder if in your work, in what your patients have been experimenting with, where AI has fitted into all of this, whether we can trust what it tells us or how we can trust what it tells us. And if someone is going to experiment with using AI for these purposes, how can they do it responsibly?
I think the best way to utilize AI is as a research tool, um, but it's not capable of making sound medical decisions for us. Um, it is um, by its nature, it's designed to please. So when you send a query to AI, it is trying to give you the answer that you want, not necessarily the correct answer or the most accurate answer. There was an experiment that some radiologists did to test AI's ability to read imaging. They fed it thousands of images. They, explained how X-rays work, et cetera, what to look for. Tried to like program this model to be, like a radiologist and read imaging. And then they took the same set of images and they gave it 10 different prompts, and they knew what the actual, diagnosis was that there was a fracture in this specific area of the bone and, some cartilage damage in another area. Um, but of the 10 prompts, only three of them identified the fracture, and all 10 had completely different reports. Um, so because the prompts were different, so the prompts indicated to the AI what to look at more, and it wasn't able to have an unbiased view of the images, and therefore it wasn't able to have an accurate, interpretation. Um, so I think that we can certainly use it to help us write something, to help us to research a topic, but ultimately the ideas need to be our own, or at the very least, we need to fact check and we need to make sure that, there's a human element behind it. Um, and I get a little bit concerned when I hear about some of these AI models being built into hospital systems and being able to help a person be prescribed for a medication. Because if AI is built to give us the answers we want, and you're someone who is, say, a drug addict and you're drug seeking, you can kind of fool the AI into giving you the drugs you want. I mean, they, drug addicts do this to doctors all the time, and it takes human judgment by the doctor to realize that, it's not appropriate to prescribe that medication to that patient because of their history. So it does concern me, that, there's definitely possibilities of this hurting people. Um, so I think there's tremendous, you know, benefit in some of the things that AI can discover and can help with. But I would like to see it used, more as a support structure and not as the primary structure.
For sure. I've heard about AI being introduced gradually to even therapeutic spaces, like for social support and some forms of psychological support. It seems like with any of these specialties, there's the slippery slope where what you're describing is that a human can use that intuition or read someone, especially when meeting in person. And the prompt is a big part of this. Most people haven't been taught to prompt well, but also AI can be set up however someone wants to set it up.
Hmm.
And that it doesn't mean that it's going to have all of the information, because also we're all unpredictable. Even if AI has been told the general norm, someone is going to come in and be the exception, right?
Absolutely. And as you said, in person, there are things like, nonverbal cues that clearly AI cannot pick up on that, could be paramount to, a correct interpretation of what someone is trying to say. And it could be very easily misheard. I mean, I've done it. I've read a text message and not realized that someone is being sarcastic about something. So and humans have the ability to dissect something like sarcasm a little bit better. So if they're the context, the physical context, the body language context is not part of the communication, there can certainly be things that are lost.
Absolutely. That's a whole thing in itself. We're all texting so much, and it's not the same as interacting in person or even having a talk like this. I I really appreciate doing video calls for the podcast, because you can read the other person even from a distance. That's something, and of course being in person is even better. Okay, it would be great to look at burnout at least a bit. I mean, I don't know how extremely busy your work is, whether you mentioned people who run and then take that too far. I don't know if that is a version of burnout, but I'm wondering whether
No,
people go
I mean,
through all sorts of things.
I've experienced some professional burnout in my career. I've worked with, quite a few people who've dealt with it. I think it's quite common in the medical field, especially with the way health insurance has become, with much lower reimbursement, higher quantity of visits that we're expected to see, and it can get overwhelming. You know, I I worked for I worked for a large corporation, with many, hundreds of offices around the country. And then I was director of rehabilitation at a hospital. And I ended up in situations where I was seeing a lot of patients and had a lot of responsibility. I started to burn out. I started to feel like I was really drifting away from the reason I went into medicine to begin with, which was to help people. I felt like the job, the work, it became much more focused on money, on profit and loss and financial statements and how well the department was doing, um, and the reimbursement and the approval, getting a certain amount of things approved by insurance. And it really watered down like the inner drive that I had, to help others. I reached a tipping point where I really, I was not happy, with the life I was living, with the job I was doing. And it really, I think I probably would have burnt out if it weren't for this annual review that I had with one of my bosses, which basically pushed me out of it. He said that my biggest weakness was that I cared too much about my patients.
My
Um,
goodness.
that the office, while profitable, he wanted it to be. He wanted us to make 20 to 30% more profit. We needed to increase the volume. We needed to increase this, that. And that hit me really hard. And I said, I can't, like, if I stay, I will burn out. I cannot stay in this environment. It's not healthy. It's not me. I just it didn't represent the ethics and the values that I believed in. Um, and, with the support of my family, my wife, who's amazing, I was able to, carve out a career and, go outside of insurance and, give the care that I wanted. And it hasn't been an easy path, but it definitely helped me avoid that burnout that I most certainly would have experienced. And I know people who are still stuck in the system and are not happy and are, just kind of pushing along to retirement. And it's hard. It is really difficult. um and it's something that not everyone has the resources or the support to do. And that's often what kind of drives burnout, is that you're literally stuck in that position. You don't have the ability to leave. You could, then you can't support yourself or your family or whoever. And it just keeps building on you.
I feel so concerned hearing about that issue within the hospital space. It's safe to generalize and say this would be beyond the hospitals themselves. You mentioned the insurance you are in America. I have seen implications from similar funding insurance issues over here in Australia, whatever it's called. I've seen that these things get complicated, but it seems like the bottom line is that very large spaces are focusing on return on investment and profitability, things like that, or even efficiency. A a former general practitioner, Jen, said on the podcast that the assumed average time of an appointment in her work was about 7 minutes. Was it kind of like that for you? People needed to show up
Hmm.
and get out very quickly?
Yeah, and it really weighed on me for quite a while. I started to become more and more aware of the people I wasn't able to help. And, I would try to fit in an extra minute or two here or there, and it became unsustainable. I would work through lunch and not do a single bit of paperwork all day so I could squeeze in 10 minutes instead of 7 minutes and get a little extra. But then then you're exhausted and you can't do that forever. So it really it gets challenging. And as you said, this isn't just exclusive to medicine. There are corporations that work that way. There are lots of companies that are, more cutthroat and more, focused on the finances than on, the quality of life and quality of, the jobs for their employees.
Absolutely. It happens in so many spaces. I'll stay super vague to say that recently I was dealing with a professional who I realized wasn't aware of any of the facts of what that person was dealing with, how many people were involved, what requirements, nothing. And I wondered, how can you give me advice if you know nothing about this at all? It doesn't make sense. But I'm hoping you can give some comfort or guidance to people who do have to interact with the medical system and they want to still feel seen, because eventually someone will go into a hospital or something else, and it can feel scary. My experience on the other end of it as not a professional is, I mentioned to you before that it was actually in 2017. I slipped in the bathroom and I'll let you know, a paramedic came to my home, unwrapped some crutches and said, look at YouTube to learn how to use these. Turns out I needed a surgery. But I was terrified. I was wondering, what's going to happen. So people go into medical spaces of any sort feeling like they don't understand what's happening to them, what's happening around them in these spaces they're entering. It's all confusing. They might feel scared of the solution or what has happened. So, and then they're dealing with a space where people want to care and they want to help more, but they're restricted by the system that they are within. So, how can people feel cared for and heard or even helped sufficiently within these spaces if that's what they have?
So I think there's two things. Number one, um, just improving your health literacy in any way. Just, reading some books, listening to podcasts, just understand it. And that's what I've tried to do, with my social media work, is just putting information and content out there, so people can learn and understand more about their bodies. Because the just having a better understanding of your body and of medicine and how the system works makes you feel a little less lost within it. And then the second thing is being your own advocate, asking questions, getting answers, and it may feel like you're holding people up or you're getting in the way, but you have every right to ask these questions. You have every right to find out what's going on, what procedures are being recommended, what your test results say. Just to make sure that you're, you're informed and you're actually making these decisions. Um, you know, and you're absolutely right. A lot of people get like pushed through the system, and they don't even know what is going on, and it shouldn't be that way. There's no reason why you can't ask a question and get information. And it may be a little inconvenient for the people who have to help you, but that's okay. You have every right to be.
For sure. I'm encouraged, and I hope everybody can be encouraged knowing that we can turn to people like you. You're putting content out there and we can trust it. At this point, most people know that anyone can put anything on the internet. And there's there's a stigma nearly around influencers to some extent because anybody can become an influencer,
Hmm.
but you're an expert and you know what you're talking about. So it seems like part of the solution then is for people to turn to the experts online, trust it. And this is the better side of the internet. People talk about scrolling, all of those things, but it's okay to browse social media and use it in a constructive way.
Absolutely. I just ask people to be critical of the content that they're reading. You know, for my part, what I try to do with anything that I post, and what I've been posting a lot more of lately, is information that is backed by a scientific research article. You know, advice that's grounded in actual science, that's grounded in an actual research trial, is much more sound than just a tip that someone gives you, in one of their Instagram feeds, that's an influencer. There has to be some evidence behind it. So that's what I would encourage people to do. And to hold to that. We there in America, there's been this, and I think globally there's been a big trend toward things like peptides, um, which are essentially like precursors to proteins, and some of the supplements, and they help to have various effects, accelerate recovery. And there we have these GLP-1s that people are using for weight loss, like semaglutide and tirzepatide, which are peptides. And there's absolutely merit in those peptides when they're used appropriately and in the right people. But it doesn't mean that everyone should be taking them. And certainly doesn't mean you should be taking them if you're not under a doctor's care, you're not under some sort of medical guidance, to make sure that you're taking the appropriate dosage, you're taking care of your body the right way. All of these things have, evidence, but there's also a structure that needs to go behind them.
The common thread here is to apply the general information to individual specific needs with guidance. Are you saying it helps to get guidance from someone who can help individually and personally?
Absolutely. And even if you're, making some of the decisions on your own, make sure that they are based on, actual scientific evidence, reliable guidance, not just tips from someone who doesn't have necessarily the background or, has done the research behind what they're doing.
There's an abundance of expertise out there. I'm so keen to see more of what you put online. And people can use the same approach to learn all sorts of things. It was during COVID that I started following people who guide nutrition. And there are specialists who use nutritional knowledge to help things like mental alertness, all of that. Whatever we are trying to learn, it's about finding the people who know what they are talking about. How can we tell? I was going to ask, how can we tell the difference? But this is beyond, we know not to just look at the one who is, we need more criteria than someone is wearing Lululemon, great. But what else can someone look for?
I think you kind of hit the nail on the head when you said individualized. So everyone's body is chemically, biologically, energetically different. So people who are giving the same advice to every single person or to the majority of their followers, patients, etc., it's unlikely that that's going to be appropriate for everyone. It's more likely that a individualized approach will be best. You know, with mental illness, we know that um, ketogenic diets can be very helpful with certain mental illnesses. For some people, the carbohydrates and the insulin have a lot to do with the way that their brain is metabolizing sugar, and it's honestly at the root of their issue. However, it's only about 20 to 30% that works in. It's not everyone, but in the 20 to 30%, ketogenic diets can be incredibly effective at treating certain mental illnesses.
Let's
But the
unpack.
other 70, 80%, it doesn't work. It doesn't do anything. So it's highly individualized. And I was just reading this very interesting post actually by a colleague of mine who was talking about that. And he was saying it's very hard to prove that with research because with research, it's all watered down. So if the diet works in 20% of the research group really well, the evidence of the study is not good because the other 80% did not do well. And when you average the effect, it's not a very significant effect. So it's interesting when you think about how these things work and how research interprets them, that, there are like these hidden treasures in terms of treatment that work for certain people and not for others, but you have to find what's best for you.
Is it that research is about what works for the majority?
Or what works for the average, but the reality is that, who's the average person? You know, no one's truly average in every category. We all have like, various idiosyncrasies where we're average maybe in a few categories, but we're not in others. So no one really fits that average individual. So these studies are guides. So I see them as potentially useful interventions. And then the important part of the research is also showing the safety of those things. So the ketogenic diet, it may work, it may not work. It's entirely safe. There's no side effects, there's no risk to trying it. So those are good interventions to try, especially if there might be some evidence that it'll help you. But yeah, it's better to have someone guiding you and helping to individualize your plan as opposed to just trying different things and seeing what sticks. Um, you know, a colleague of mine who's very much into lab work, way more than I am, these functional laboratory tests. She loves to say, tests don't guess, you know. So there are excellent labs that you can do to figure out, if you have gluten sensitivity, if you have these various things, and then based on that, you can structure an intervention that is much more likely to be successful because you have data behind it. So I think that's really the best way to use these things. And AI is helpful in some of those in terms of reading that data and coming up with potential, connections that we may not have found because we don't have that processing power. So it does fill in certain places. But it should be used as part of this whole and with someone behind the wheel.
It's fascinating hearing about the keto diet. I will share that I eat whole plants, but I find on some weeks or some days, having a bit extra olive oil feels right for me. So even what I need varies between different weeks. But I've seen that some people want those other categories. But the thing that got my attention in what you said, what got my attention a lot is the carbs. I the best way I can ask these questions is by drawing upon an example, right? And I was on a trip recently where for a whole few days, most of what was available was bread and jam. I could feel it. You're sounding like those carbs or look, I'm not anti-carbs. I think carbs are awesome, but I'm curious, what did people see with how a spike in carbs or sugar or something like that can affect the mind?
So in a lot of people, carbohydrates and sometimes it's specific types of carbohydrates depending on your body can cause spikes in insulin, inflammation, bloating, and then this like postprandial like it, you know, insulin spike with a glucose drop where, there can be that kind of fatigue, sort of like hangover feeling when you eat too much. And that's a very real thing. So when it comes to carbs, I think it's just identifying how your body responds to them. And if it doesn't respond well, it's either minimizing carbs or figuring out what carbs are compatible with your body. Um, One of the things in the longevity medicine field that's starting to become more and more popular is using CGM, continuous glucose monitoring, the little attachments, but in non-diabetic individuals, to determine what foods work best with your body, what foods are causing glucose spikes, and then you can identify what diet is best suited for your gut and your microbiome. And it's different across the spectrum. I have a friend that, you know, he his body doesn't respond well to apples. He has a massive um glucose spike with apples. Um, but he doesn't have a glucose spike when he has pasta. Um, and another colleague of mine, sweet potatoes. He cannot have sweet potatoes. His body just responds really badly to sweet potatoes, but regular white potatoes, no problem. So it just shows there is no generic diet that's going to work for anyone. We all need to, establish something more precise, more specific. Um, and if we can, at the very least, there are diets like the Mediterranean diet, or just even eating more whole food, whole plant, less processed, that we know to be safer and better on the whole. Um, but I think, adding that level of precision can just make a big difference in terms of how you feel on a day-to-day basis, and just figuring out, how best to keep your vitality and your energy up.
Have you seen that a common thread for pretty much everybody is to at least start with eating real food, like you said, instead of the processed foods? Is that a good general guideline for everybody as a starting point?
I think so. At the very least, trying to incorporate more whole food into your diet. We're realizing more and more, and America's considerably worse in terms of the way we process food with, GMO and microplastics, high fructose corn syrup. There's just a lot of additives in our processed foods that, you know, it's actually interesting. I was reading something the other day. There was like this list of all of these things that are in American processed foods that are illegal in many other countries throughout Europe. Like they're not even allowed in foods in Europe. And it really makes you think twice about having something that has that in there, because like if it's illegal elsewhere, like there's got to be like it can't be good. There must be a reason why they're not allowing it in their food. um and so it the more you read and the more you learn, and I think that's where this being, an educated consumer and being more informed helps you realize the why. And I think that's the best way to help someone to improve their diet, is rather than telling them to just start eating XYZ, showing them why it's beneficial to do that, and why it might be harmful to have these other things, in their diet, and what's in it, and what, long-term implications might exist to having that. Um, because then they're making the decision, and they're more likely to stand by it.
They will feel informed. Will these new habits also help the nervous system?
Yes, absolutely. I mean, it it having a cleaner diet, um, the the gut and the immune system and the nervous system are interconnected. I'll go a little sciencey here, but there's the vagus nerve, VAGUS, is located in our neck, and it dictates how our nervous system works, but it also plays a role in our gut and our immune system and digestion. So if we have a better, cleaner diet and digestion is easier, then that frees up resources for our nervous system to be stronger and to function at a better capacity. Um, you know, it's useful to think of the body as this closed system that has a finite amount of energy, kind of like a car having a certain amount of gasoline as, fuel. And, the way all of these systems work, they each use some fuel, they each use energy in a certain way. And if there's a system that's monopolizing our body, that's using energy too much, it leaves less energy available for the remainder of the systems. So if you're eating a clean diet and your gut has less on its plate, it doesn't have to work as hard. Other systems are able to dedicate more resources to repair, to all of that. And that's where, we've seen people with GI issues, become, improve their gut health and the lining of their gut and things like that in response to these healthy diets. And it's not the food, the diet, like the food doesn't make the gut heal. The body heals the gut, but the body's able to heal the gut because you make it easier on the body. You've now allowed the body to be able to finish the job. And the same thing, it works the same way in orthopedics in terms of injuries. If we're able to optimize the way the body is functioning in terms of the gut, the nervous system, all of these systems, now more energy can be dedicated to laying down collagen tissue, scar tissue, fibroblasts, etc., and healing that particular soft tissue injury that you have in your, meniscus of your knee or your rotator cuff of your shoulder or, ankle sprain, etc. Um, it's just the energy has to go somewhere, and it makes a lot of sense when you see it that way.
Are you saying that if we look after our dietary habits and our nervous systems, the basics, we can have more progress towards healing?
Yes, absolutely. And often that's the reason why people are unable to heal is that their body is too taxed in terms of the other things that are going on, so it's not capable of mounting an appropriate healing response.
Whatever is going on, whether we have a small issue or we had a small or a big T trauma, looking after the basics will help us.
Absolutely. No, it's essential, and it factors into virtually every type of healing. And something that's easier to think of in terms of, like, say, visual proof is if you think about something like wound healing, so a big wound and its ability to heal, um in individuals that have better health, cleaner diet, less systemic inflammation, the wound is going to heal much quicker and actually much cleaner. Like the borders of the wound, the scar tissue, the way that it heals will actually look nicer versus someone who, let's say, is diabetic or has chronic stress or, you know, improper diet, etc. There will be like a significant visual difference in terms of quality of the wound healing and the time that it takes for that wound to heal.
We really
We've
are.
all heard about diabetics and how they can have these ulcers that don't heal, and that's because their body is overwhelmed with dealing with the diabetes and all of the sequela of the diabetes, so they're not able to finish that healing process.
We are what we eat.
Hmm.
You look at so many different topics. I'm keen to wind up by checking which issues will someone learn about and get empowered to improve by looking at your content? We've talked about the nervous system and food, and of course, orthopedics and burnout, all sorts of things. What do you teach everybody in your content, and how can they connect with that?
I think my larger content is geared around pain and illness and injury. So better understanding the context behind the struggles that you may be dealing with and looking at it from all of those various angles. And once you do that, you're able to get the full picture of what's going on, and address the primary cause, so like the root cause of the problem, as well as secondary causes. And when you do that, the outcome is obviously going to be much better. And then the resilience and the risk of recurrence, that's really the key when it comes to things like chronic pain, is preventing recurrence. Coming back of that problem will be much lower because you've identified those key factors that led to it in the first place, or that led to it coming back. So as I said, I think it's about, learning and being able to be your own detective, and then asking the right questions and knowing how to advocate for the right care. Um, and in the case of going to a hospital, you don't have as much freedom to choose, who is conducting your care because you're in an emergency situation. But for other, routine medical appointments, for nutritional advice, for personal training, for, other health related advice, you do have a choice, and you can seek out the people that have the right qualifications and are really invested and really do care. It is not a weakness to care too much about people. I don't care what, my former boss said. So, you want to find people to be on your medical team and on your health and wellness team that have your best interests in mind and that are helping you to learn how to better take care of yourself. And when you do that, you start to become much more empowered and feel like you have more control over your destiny and your fate. And that's my goal with every person I work with, every patient I work with, every one I try to reach on social media, is to really try to make you feel more powerful and more informed about your own body. It's a little corny, but I like to say you are the medicine. um, there's a lot that you can do if you just figure out the right interventions, the right strategies, and you learn how to better take care of yourself.
This is empowering. Dr. Sean Altman, thank you so much for talking about all of this on the Motivated Collective podcast.
Thank you.